Good afternoon, my people. We are still tackling our very important topic and most common disease in our today's life, which is diarrhea. And I know so far so good. The far we have gone, each and every one of us is gaining something out of it. I'm still trying to encourage those who have not subscribed, or those who have not joined our channel, or those who have not joined our family, because this is a family, to consider doing so, because by the end of this year, or as time goes, most people will benefit from this. And so far, a very big number is appreciating what we are doing. So let's continue subscribing, let's like, let's comment on our videos. Back to our topic. Today we will start by talking about treatment options or management options available or that you can apply for dehydration. Treatment involves replacing fluids lost. Treatment for dehydration involves basically replacing the fluids lost or hydrating or rehydrating the person who has the dehydration. For mild to moderate dehydration, this includes, or the options include, drinking water, all other fluids, for example, juices or broths. Vomiting and diarrhea can lead to significant loss of electrolytes as well as water. Vomiting and diarrhea can lead to significant loss of electrolytes as well as water. In these situations, or in such situations, drinking beverages that contain electrolytes may be helpful or may help. For example, sports drink and Pedialyte. We have always talked about this sports drink and Pedialyte, so nothing is new here. That's why I'm not giving so much explanation, because we talked about them during food poisoning, during vomiting. It's just a repetition, because some topics, as I said before, will relate to each other. For example, vomiting and diarrhea both cause dehydration. So most probably some signs and symptoms and the remedies and the treatment options may be close to each other or may rhyme. So if dehydration is more severe, for mild to moderate, we have said you can take a lot of water, a lot of beverages and broths. But if dehydration is more severe, hospitalization or hospital admission is always advised for intravenous fluids, or for fluids to be replaced through the vein, because we all know the effects or the complications of dehydration. For example, stroke, we have brain shrinkage and kidney damage or kidney failure. What are the tips that can be applied to prevent dehydration? We always say that prevention is better than cure. So what are the tips you can apply to prevent dehydration? If you are an older adult, the following tips may help you stay hydrated. The key point here is to stay hydrated. So what are these tips you can apply? Number one, drink water. Drink water throughout the day. Drink water throughout the day. Other beverages may also help with hydration. or replacing the lost fluids. So drink water throughout the day. Other beverages may also be helpful in hydration. For example, milk, flavored water, fruit juice with low sugars, fruit juice with low sugars. Drink coffee and tea sparingly because they may have diuretic effects. This means that sometimes coffee and tea can make you urinate a lot and lose a lot of water. That is what it means by having diuretic effects. If it's hard to drink too much liquid at once, take small sips. If it's hard to take a lot of fluid at the same time, for example, you can tell me you can take a whole jug of 10 liters at a go, but you can take small sips severally. At the end of the day, you'll find that you have taken a lot of water and you are hydrating yourself. Include foods in your diet that have high water levels or high water content. For example, watermelons, cucumber, strawberries, and low sodium broths and soups. Let me repeat this. Include foods in your diet that have high water content. For example, watermelon, cucumber, strawberries, and low sodium broths, all soups. Number 4, if you don't find water appealing, try adding a slice or squeeze a lemon or lime to add flavor in the water. If you don't find the water appealing, try adding a slice or squeeze a lemon or lime into the water to add flavor. Number 5, plan to drink more water if you are going to be out in hot or humid conditions. Plan to drink a lot of water if you are going to be out in hot sun or humid conditions for a prolonged period of time. Or if you are exercising. Obviously, when you are doing your exercises or your workouts, you will lose a lot of water through sweating. So you have to plan to take a lot of water to stay hydrated. If you are ill with symptoms like fever, vomiting, diarrhea, make sure you drink more fluids than normal. If you are ill and having fever, vomiting, and diarrhea, because obviously this will lead to dehydration, make sure to drink more fluids than usual. If you have an underlying condition, if you have an underlying health condition, speak with your doctor as you ask your specific fluid and hydration needs. If you have an underlying health condition, speak with your doctor to assist you with the specific fluid and hydration needs. This marks the end of our topic about dehydration. It just came as a branch or a subtopic in our discussion about diarrhea. So in the next topic, we are going back to diarrhea as a topic. This was just a subtopic in a major topic. So let's continue subscribing, sharing, and liking our videos so that they may reach as many people as possible and help the community at large. Let's meet in the next video.